So I am Destiny Smith. I'm a part of the Community Advisory Board at the Well Project. I am also a blogger with A Girl Like Me. I have published a book called Living My Truth. I am now 25 years old and I have been HIV positive. It will be 4 years the day after Christmas this year. Um, I think that's it. So, Gina, if you want to introduce yourself.
Yes. So I am Gina Brown, a woman living with HIV for 27 years in April. So older than my HIV is older than you, Destiny.
I know.
Yes. I'm a community engagement manager at the Southern AIDS Coalition, and I'm also on the Well Projects CAB Community Advisory Board. And I attend the Well Project's Women's Research Initiative on HIV and AIDS.
Okay. Um, so one of the reasons why I wanted to interview you, I was reading your bio actually on the Well Project, and I seen how long you have been HIV positive and how you deal with it, and that you also went back to school to be a social worker, and that's something I've thought about. I haven't did it, but I thought about it, and it kind of just drew me to you. So I just wanted to get a chance to talk to you and get to know you. Um, yeah.
Thank you. And I'm glad to hear that you're thinking about school and that you're thinking about social work. You know, social work is one of those professions that is really, really rewarding. It's rewarding.
Hmm.
It's a little work, but it feels so good when you see someone go from point A to point C.
Yeah.
And you know that you helped them somehow in that journey. So thank you for wanting to join that profession. You know, I love being a social worker, even
Hmm.
though I don't work as a social worker in a clinic or anything. I'm a community engagement manager, but that's still social work, right?
Yeah.
You're still helping people navigate things. You're still training people and teaching them, educating them, all of those things. So, yeah. So thank you for
Okay.
choosing me.
Thank you for showing up. Okay, so we can get to the first question. My first question for you is what drew you to HIV advocacy work, like, and what keeps you in it?
What drew me to this work was going to my clinic, my HIV outpatient clinic,
Hmm.
and we had a men's side and a women's side, and they would come to the door and they would call you by your first and last name. And I'm from New Orleans, and in New Orleans, last names are really unique. You'll hear a last name and you know the whole family, right? Because
Hmm.
so they called this one lady's name one day in the waiting room, and every head in the waiting room was filled with women, and we all turned and looked at her. And I can remember the look because we knew her name, we knew her
Yeah.
family, and I can remember the look on her face. And I left there that day and I went home and I called the clinic back and I spoke to a lady and I said, I don't think they should call us by our first and last name.
Hmm.
I didn't even know it was called advocacy. I didn't know that I was speaking up for people. I thought I was just doing what was right.
Yeah.
And she said, well, what should we call you? I say most our providers, our doctors and nurses know us. So they can just come and call us by our first name.
Hmm.
And the next time I went to the clinic, we were going every 3 months back then. This was ages ago, Destiny. You weren't even born yet, child. But when I went back to the clinic, they called me by my first name. And that's when I kind of knew. And then I knew that I wanted to continue to do that to help people, especially women who look like me.
Yeah.
I was, when I started in this thing, I had a GED. I was in I'm in recovery. Um, I've been in an abusive relationship. So I thought of all of the women like me who nobody was really speaking up for,
Hmm.
and I wanted to be a part of that. So I guess it was being selfish. That's what, drove me to HIV, yeah, because I wanted to be a part of something bigger than me.
I love that. And I definitely get the recovery part. In my book, I actually talk about my mom. She has been clean and sober going almost 9 years. Um,
That's amazing.
and
I love
I
it.
went through the whole thing with her. Like I was 13 years old in church praying late at night for her to be able to fight that and overcome it and be able to be in, not saying she wasn't an actual mom, but to be there present as herself all the
Yes.
way. And since she's been clean and sober, our relationship is a lot stronger. She's literally like my best friend. So I definitely get that. And she's one of my biggest supporters. And I think being clean and sober and HIV and all the things we do to fight for HIV, it kind of goes head and head together. And I don't think a lot of people know that.
Yes.
So I like
Yes.
that. Our second question, as someone with decades of HIV advocacy experience, what advice would you give to women who are newer to it?
The first thing I would tell someone, a woman who's new to this work or to this fight, is be careful what you share because once you put it out there, you can't take it back. And always remember that if you don't center you, you can. If we're not well, we can't help other people, right? So if I'm
Mm-hmm.
not centering me and taking care of me and drinking my water and exercising and doing something to look out for me, then when I go into community, I can't help community. And I
Exactly.
think about it even like as far as like our mental health, something we don't talk about a lot. But I've been in therapy for years because I understand that I can't go and stand in front of a group of women who may be just as broken as I was
Mm-hmm.
without me fixing some part of me so that I can stand with them and help them to fix some part of them, you know.
Yeah, I love that. Can you talk about the importance to you of both having a mentor and being a mentor?
Yes. So having a mentor allows you to really grow, especially if you choose someone who's experienced in this. My mentor, I went to a training, and when she walked in the room, I knew I was watching myself in the future walk in that room. She was me, and I was with one of my friends, and we looked at each other because the girl who walked in the room with her was my friend, and I said, "That's me," and she said, "That's me," and they had our personalities, and I knew that I wanted this woman to be my mentor, and I knew I could grow and learn from her.
Mm-hmm.
I have a saying because I deal with a lot of young people. Um, Everybody doesn't need mentoring. Some people need mothering, and I've learned I've learned the
I
difference.
understand that.
So, so my babies that need mothering, that's what I give them.
Mm-hmm.
And those who ask for mentorship, I give them that. And it's important for me to give back too, right? So
Mm-hmm.
I've learned from this amazing woman who poured all this stuff into me. So it's only fair that I pour into somebody else. You know, I always say, like, what she told me when I asked her, Linda Scruggs, I said, "Will you be my mentor?" And she looked at me and she said, "Yes." She said, "But I'll tell you one thing." And I was like, "All right, what?" I thought she was going to like give me the secrets of the kingdom or something. She said, "I will not call you. I will not run behind you. If it's something you want, you will call me." And I
Mm-hmm.
would call her and I would ask questions. And there have been times as a mentee that I didn't want to listen, but I knew that I had to. Like once I was mad with somebody and I like went off on them on Facebook. And I did it early in the morning and she happened to see it and she called me and she said, "Take it down." And I
Mm-hmm.
was like, "No, I want them to see it." And she's like, "Nope, you're on the road to leadership. Take it down." And I took it down, you know. But it is important. It's really important because we can't navigate this stuff by ourselves.
Yeah.
It's bigger than us. There's a lot of policy involved. It's a lot of human feelings involved. And if we don't know how to interact with each other, then we all in trouble. So as a mentor or a mentee, I've learned that when I'm reaching with one hand to grab onto her hand, I got to put a hand down and let somebody grab my hand. I can't do it just one way, you know. And it's a good feeling. It's a good feeling to know that I can go to her when I need something, and then to see my mentees come to me. And just like a parent, you always want your kids to be better than you. So I
Yeah.
want my mentees to go higher than me. You
Yeah.
know, get a PhD. You know, I'm screaming, get a
Yeah.
PhD, get an MD, get whatever. I want you to continue to move, because you see all this white hair. You know, it's almost time for me to like just sit down and, you know, and do some other things. I'm not gonna leave this movement.
Yeah.
You know, I'm in it for the long haul, but at the same time, where I am in the movement, I am okay with moving out the way and letting somebody else occupy that space. Especially one of my mentees, because I know I did them right by
Yeah.
giving them what I have. So I'm okay with them being there.
Yeah. Yes, I love that. I think I speak on that all the time. Mentorship. I think everybody should have mentors. I can't force people to get them, but I think everybody should have them. I literally have a mentor in every aspect of my life. I
Yeah.
have a mentor for my HIV advocacy. I actually met her through the Well Project. I have a mentor for like my business. I have a life mentor. I just feel like mentors are everything, and everybody can learn from everybody. So I
Right.
definitely get that.
Yes.
Um, the next question is, how do you lift up um, advocates who are newer to the field, and why is that important to you?
Well, the first thing I do is I love going to conferences, and I love meeting people who are there for the first time,
I've never
because
been to
I
one. I want
want
to
you
go
to
to
have,
one.
huh?
I've never been to one. I want to go to one. So
But when you come, you will see. I want your experience to be so good that you come back.
yeah.
You know, so I will spend time with a new person. I will talk to them. I'll introduce them to people, because I
Hmm.
understand how it is to walk in a room and not know anybody. You
Yeah.
know, I think it's really, really important for me to give a new advocate a platform, help them get a platform. And, you know, we used to always say back in the day, I speak for the people who don't have a voice. And then I realized that we all have a voice. Some of
Hmm.
us just don't have a microphone. So
Ooh,
I
I
started
like that.
passing the microphone,
Yeah.
you know, and that's the thing with new people, with young people, with new people, giving them an opportunity
Hmm.
some things. You know, if you're invited to all of the meetings, and sometimes say, you know what, I can't come, but I know the perfect person. Let me call Destiny. You know, that kind of thing.
Yeah.
And that's how you move people in this work. That's how you move people in this movement, you know, by giving them opportunities, by
Hmm.
making sure that you're not becoming that dinosaur in the room, because you've been in that same seat forever, and you
Hmm.
don't want to move because you think if you move, they're going to forget you or something. They're not going to forget you. We have to lift each other up.
Hmm.
Not be afraid of somebody coming. I want y'all to have more knowledge than I have. That means we've done a good job of giving y'all that knowledge.
Yeah.
Well, yeah.
I love it. I love it. Um, what made you decide to go back to school, and what impact has it had on your life?
So I went back to school after Hurricane Katrina in
Hmm.
2005. I found myself in Dallas, and I went to the hospital. I was interviewing for a job, and they had this one job that would have been perfect for me, but I didn't have a degree.
Hmm.
And I realized not having a degree was really hindering me. You know,
Yeah.
everybody doesn't want a degree, and I understand that, and I don't try to push it on people. But if somebody say, you know, I want one, I'll help you figure out how to get to that point. But I wanted to give more to the community. And I remember this girl, she was living with HIV, and I told her, I said, I'm going to school. And she said, I don't know why you're going to die. And I can't, you know, and I'm a lot more polished now than I was. And I kind of turned and looked at her, mean mugged her, and I said, "We gonna all die. I just want to die with some
Yeah.
letters behind my name."
Okay.
Because that was my truth. My truth was I wanted this for me,
Mm-hmm.
not for anybody else, and it impacted my life. First of all, going to college at 41 was an experience. I was the oldest one in most of my classes. And I sat in the front of the class. Class ended at 9. The professor would ask at 8:55, anybody have a question? And my hand would go up, and I could feel the kids behind me like boring holes in my back with their eyes. They were
Yes.
so mad at me. We never got out of class early because of me. And one day, one of the little girls, well, I call them little girls, young women, she said, "Miss Gina, can we get out early tonight?" And I said, "Baby, let me tell you something." I said, "When you're young, you can play with school." I said, "I'm an old woman." I was 41. I said, "I'm an old woman." I said, "I'm paying for this." So I'm gonna answer every question I can. And
Okay.
she got it. She was like, "Okay," and just walked away. And I realized that it was a different experience for me.
Mm-hmm.
I'm one of those people that no matter, and not bragging, but no matter where I go, no matter what I do, I kind of become popular. I don't even know why. Like, why do people want to be around me? I'm not interested, that kind of thing. But on campus, I told my story.
Mm.
And I would walk across campus and the kids would say, "That's Miss Gina. She knew everything about HIV." I would say, "No, I don't." But they all got to know me. That experience was amazing. I made the dean's list. I never graduated from anything but kindergarten in my life. And I made the dean's list every year, you know, um, and it just gave me this sense of pride. I went to HBCU, Southern University, and just in Louisiana, just going to SU is like a badge of honor. It's like going to Howard University.
Mm-hmm.
So it impacted my life in a really positive way. And it made other women in this movement look and say, "She did it, I can do it too." And that's what it's all about.
That is. Your story is everything. Um, One more question. In the leadership exchange you did with Chuck, is it Wyra? I don't want to say his last name wrong.
Chuck Weir.
You said that 5 years from now, you see yourself doing a different kind of work. Can you describe what you'd like to do next?
The next thing I like to do is real housing work. So not just for people living with HIV, but for the broader community. So making sure that policy and programs are addressing the real need for housing. And when I say that, I'm talking about stable, affordable housing, right? A
Mm-hmm.
lot of times programs and vouchers are connected to units, and you don't always put people in the best unit, right? So I want to make sure that people are really, that we're looking at homelessness, the unhoused population, in a way that that's done with dignity and respect, that we're helping to move people from unhoused to housed and working
Mm-hmm.
with them while they're housed so that they don't become unhoused again. You know, when I did case management, I was the housing case manager at a Part A program here in New Orleans, and that was one of the most rewarding jobs I ever had. Um, Being able to work with people and to help them get off the street and into a house, being able to help them connect housing with their health care, because housing is healthcare and housing is prevention.
Yes.
And it doesn't just prevent HIV, but it prevents all kind of other things. Housing can prevent addiction, because if I'm homeless, I'm already feeling bad about myself,
Mm-hmm.
right? So I'm either gonna drink, I'm gonna smoke, I'm gonna take some pills, I'm gonna do something to self-medicate to make me feel better.
Yeah.
So really working with the unhoused population as a way to really make a difference in our communities. We have so many abandoned houses, and they have people sleeping on the ground. And I'm
Yeah.
like, well, why we can't have a program where we all just get in there, almost like Habitat for Humanity, and
Mm-hmm.
we fix it up and we move people in? Why can't we do that? We can't do that because the policies haven't changed. So have to work on both sides of that, the policy side and the program side.
Oh my God. I'm just thinking because on one of the questions earlier, you said when your mentor walked into that room, you knew that was you.
Yep.
And you telling your story, and I'm just like, that's me. That's me.
What?
Because I'm so stuck on, there is a abandoned hotel where I live, over 100 something rooms. It has conference rooms. It has a restaurant. It has so many things, and I want it. And I want it so I can house homeless people and put stations in there where they can learn different skills and different things that they don't have to go to school to get jobs, but they can still get jobs. They can get back on their feet. We can help them get housing. Everything they need will be in this one building. And when they leave, they'll be good to go. They don't have to worry about being back on the street. They don't have to worry about not having someone in their corner fighting for them. And you're just telling your story, and I'm like, that's me. I'm gonna have to call Gina when we get off of here because
Yes.
I love that.
What's the thing that drives you, Destiny? What's that thing that put you on this course? I'm not talking about your diagnosis. I'm talking
Mhm.
about having a heart that you have. Because you say you were a
Um,
kid praying for your mom.
yeah, I think so when we were younger, we were raised in the church. I mean, we went to church every Sunday. I was on praise dance teams. I um God just always, when I went through things, I could be alone, but I never really felt alone. Um and I've always treat others how you want to be treated. I don't like seeing, like, I live in Iowa, so our winters be so bougie, it's crazy. Like, we can have a hot winter one year, but the next year it's like we got negative 100 degrees and all these people are sleeping outside, and it's like people just drive by and they don't care. Like, when I was maybe 15 or 16, I used to hang out a lot and drink a lot. And me and my friends were actually leaving the liquor store. And there was a guy out in front of the liquor store. And he said he just needed a few dollars to get some gas so him and his mom could make it back to Iowa City. And all I had was a 20. And I gave him that 20. And everybody I was with got tripping, like, why are you giving those people your last $20? And he's not about to do nothing but go in the liquor store and buy. That man said he needed gas money so him and his mom could fill up their car and get to Iowa City. When I gave him that $20, God no, I was giving him that $20 because that man needed to get home, and that's what he told me. I feel like everybody needs help, but people are sometimes afraid to ask for it because everybody judges.
Yep.
Everyone judges. They act like they don't, and we've all done it. I've done it. I
Yep.
can have the biggest heart in the world, but I'm still judged, and it's not right. And I just feel like if I can help people, I want to help them. I want to get homeless people off of the streets. If I could help every homeless person around the world, I would,
Yep.
because it's too much. Like, people are so stuck on what did they do to get there and why did they stay there so long. It doesn't matter. You never know what someone's going through. You
Yep.
don't even know if you could live 30 seconds in their shoes, and you're worried about, well, if he didn't choose this, he wouldn't be there. Or if she didn't do this drug, she wouldn't be there. You don't know why she even started the drugs.
That's
You
right.
don't know, you don't know what happened when she was younger. You didn't ask her anything. You just looked at her and you started judging.
Yeah.
And I just feel like I just want to help everybody. I want everybody to be in a home, be warm, be able to, if they want to work, be able to take care of their family, know their family, just have somebody there.
Yeah.
Because having somebody is literally everything, especially after 2020. Having somebody is everything.
You have a good heart, and don't let this old world change it here.
Yeah,
Because then you're gonna fall down. You might get beat up sometimes, but get back up and
yeah,
keep your heart, because that's what's gonna get you through all of this. I
right.
think about that a lot. That I genuinely like people. I
Mhm.
really like people. So it's easy for me when I see you to hug you. It's easy for me to give you a kind word. I'm one
Yeah.
of those women that If I see another woman and I pay attention to shoes, I don't even wear heels, but I love to see women walk in heels.
Yes, I don't
And
wear.
I might look and I'll be like, girl, those shoes. And that's all I have to
Yes,
say. And the smile that comes on their face. Because I like to make people feel good. And like you have that same heart.
yeah,
So don't lose your heart.
yeah.
What made you write a book?
Um, so when I found out my status, I kind of shut down and I didn't do anything. Like I was working 2 jobs. I was actually pregnant with my second child when I found out. Um, and we don't, nobody around here really talks about HIV. So the only thing I really thought about is stuff I seen in movies. So how long I got to live, when am I gonna die, like what's gonna happen to my baby? I got another human growing inside of me and
Mhm.
she's already feeling it. Um, so when I got out of that depression, I actually came upon the Well Project and I started blogging and just being able to express myself with people not judging me and people actually leaving kind words and stuff like that. It just everything I poured out onto paper and wrote, I just put it all together and published it. Um, I just wanted to be able to tell my own story because even when I told my story, it wasn't because I just woke up one day and was like, let me just tell the world I got HIV. Other people were telling my story, and it was people who wasn't there or people who didn't even talk to me and ask me anything. And I just feel like no one can tell my story. My story is my story. If somebody's gonna tell it, it's gonna be me or God. So I wrote the book and even when I wrote my status, because when I told my story, I did make a public status on Facebook. I got a lot more genuine, loving comments than negative. Like all my family members were calling me, talking about they were arguing with people, and so said this, and I never seen none of it. Like all the negative stuff, I never seen it, and I just know that was God.
Yeah.
Because everything I seen was positive stuff, even from people I would have thought would have judged me, and that's me judging them. um, but yeah, the book just it really helped me. Like it felt like once I did that status and once I wrote that book, so much weight was lifted off of me, and it was just like, just live your life and
That's right.
whatever
That's right.
happens.
Just live your life.
Yeah.
That's why I talked about being in recovery a lot when this was before my diagnosis.
Hmm.
Um, and I was working at a nursing home. And this girl said, "Why you told them you was in recovery?" I said, "Because y'all already knew, and y'all was gonna tell the wrong story. I
Right.
need to tell the
Yes.
right story." So
Yes.
that's smart. That's smart, and I'm proud of you for
Thank you.
doing that, for taking your destiny and see your name destiny, and you took your destiny in your own hands.
Yeah.
You didn't allow somebody else to paint you the way they wanted to see you. You painted
Mhm.
yourself the way that you see you, and that's big. You know,
Yeah.
I'll tell you, Destiny. A lot of what I've experienced in this movement has been very positive. It's been very loving. It's been nurturing.
Yeah.
Um, it's been a place where I feel like no matter what I say, somebody in that room gonna understand.
Hmm.
Somebody's gonna get it. And that's the beauty of when we all come together in coalition, when we all come together in sisterhood. And
Hmm.
that's why I think the Well Project is so important to us, right? Because you found them.
Yeah.
And you found them because they make sure they're visible. You know what I'm saying? So not only can a Destiny find them or a Gina find them, but some little girl today who may be looking can find them.
Hmm.
And then in finding them, she's gonna find us.
Right.
She's gonna find us. And in no time, you're gonna be sitting across from a new person, and that
Hmm.
person is going to see themselves in you know and it's going to make you, because when you said that, I just felt like not prideful
Hmm.
but proud.
Yeah.
Proud that I live my life, or that my life is in such a way that someone like Destiny can look at it and say, wait a minute, that's me. That's me. And I
Yeah.
love that. Not that it's me, but that you can actually look out and see yourself in someone
Right.
and know that you can go as far as you want to go, sweets.
Mm-hmm.
And that's the beauty of this, 4 years in, you tell your story, you write a book, you write blogs, you're sitting at this, because, being a cab member, we are decision makers. You're sitting at this planning body, this planning table. The next thing is just getting you to a conference.
Yeah.
And you meet more people, because I know, like you say, they don't really talk about HIV in hours. So not that you want to talk about it every day, because some days you're not going to want to talk about HIV.
Yeah.
That's going to be the day you might just want to talk about people who are homeless, the
Right.
unhoused. Let's talk about them.
Mm-hmm.
Or even, it might not even be about real people. It might just be about a character on TV that you want to talk about. That
Yeah.
whatever it is, always do what feels good to you. I said
Yeah.
all that. See, my daughter tell me all the time, Mama, you go around the block just to get to this one point. I said, I don't care. When you get as old as me, you do that sometimes. But for real, how are your kids? How are they doing?
My kids are good. They are so smart and intelligent, and I haven't had the specific conversation with them yet. They're still young. My son will be 6. My daughter will be 3 this year. We actually have the same birthday, me and my daughter.
Really?
Yeah, we have the same birthday. Um, they both know I take medicine every day. But everything I do really is for them. So they see a strong mom. They see somebody who gets the job done no matter what the situation is. And my kids, we're all cancers, so we're all soft. We're big crybabies. So they will tell me they love me 100 times a day, and that's all I need to keep pushing. Like,
Yes.
those little people are everything. So
When my daughter was little, before I told her my status, because I was pregnant with her when I was diagnosed, so
mhm.
she's always been a part of it. She just didn't know. But before I told her my status, when she went to kindergarten, I told her, I sat her down and I said, if it's wet and it's not yours, don't touch it.
Yeah,
Because little kids, if somebody's bleeding, the first thing we want to do is put our finger in it. We
that's
want
my
to
daughter.
touch it.
She want to drink after everybody. And I just be like, girl, you just let it go. If you
And
thirsty, call me something. We can get you something to drink. Don't touch it.
but
Let
I
it.
was like, if it's wet, don't, if it's wet, it's not yours, don't touch it.
Yeah.
And then when she was 7, but this was years ago, and there was a book called Anissa Story. My grandma has AIDS. And because she asked me, she said, why do you take all those pills? And I'll lie. Don't what? And we read the book together. And that's how I
Yeah,
disclosed my status to her. And now she works in the field. And
I
she's
love
not
that.
living with HIV.
Right. Yeah, I love that. I know. Uh, September of last year, I actually quit my job because I was a part of the cab last year. I didn't get to do a lot because I was working full time. I didn't really get to see my kids a lot because I was doing school, working full time. So I actually quit my job and now I just do all things entrepreneur. And with my kids seeing that, my son's the same way. Like, anything he sees me do, he wants to do. So we've actually been talking about writing a book together. So the book will be of the conversation of me telling him my story and what I went through and why things are the way they are and how he doesn't have to, because he's very overprotective, even though he's so little, that he doesn't have to protect me or worry about things because I got this. So it'll just be a conversation of mom has HIV and let's talk about it.
And that'll help so many people, because that's still the two groups of people that people really struggle with telling, and that's their parents and their children.
Mm-hmm.
Because we know that with HIV, people really think about a behavior. They don't think that HIV is just a medical condition, really. You know,
Mm-hmm.
because if somebody told you they had cancer, you wouldn't say how many packs of cigarettes you smoked.
Yeah.
So if I tell you I'm living with HIV, you shouldn't say how did you get it.
Yeah.
That no, don't even ask me that.
Right. So that
Uh,
question is so annoying.
it
Like,
is. It really is, and that's not what doing that with your baby will help people answer that question of how do you tell your children,
Yeah.
you know, and you tell them in a way that it's not going to harm them, that's not going to scare them, you know.
Mm-hmm.
And the beauty of it is we know so much more now today than we knew 25 years ago,
Right.
you know. So I can't wait to, I'm gonna get your first book too, but I can't wait till you write the second one because my grandson, he's 10, so he knows. I always tell him, Gigi got HIV, right? And you're like, yeah, Gigi, I already know that. How many times you gonna tell me that? He said, even though I don't know what HIV is, you just keep telling me.
Yeah.
I'm like, yeah, he needs to know like what it is,
Yeah.
that kind of thing. So when you write your book, I'll be sure to buy it.
Definitely. I appreciate that. Let's see. That was all of the questions. But did you have any more questions or final thoughts?
I just want to say, Destiny, thank you so much for interviewing me.
Thank
Matter of
you.
fact, you didn't interview me. Thank you so much for this conversation that you
Yes.
and I just had. You cannot tell that there's a 26, 20. Oh, Lord, you 25. A
Yep, I'll
third,
be
oh, Lord, a
26
30-year
this
difference.
year.
A 30-year difference in us because we were able to really um come together against that. Well, come together in spite of our age difference. And
Mm-hmm.
this is what an intergenerational conversation really should look like.
Yeah.
Not me sitting here thinking that I know everything.
Mm-hmm.
And I'm going to tell Destiny how to live her life. No, no. Destiny might be able to tell me how to live my life, that kind of thing. So thank you for sharing with me. Thank you for having this conversation with me. And thank you for everything you do.
Thank you. Thank you for letting me talk to you and have a conversation with you and get to know you. I have your number now, so I'll probably
Yes,
start
you
getting on your nerves. But I really appreciate you and everything that you do.
yes.
Yeah.